I'm about to reveal something that could impact you deeply. Something you might have right now in your medicine cabinet, silently attacking the most important organ in your body. And I'm not talking about exotic drugs or experimental treatments. I'm talking about the painkiller you took this morning, the stomach pill you swallowed with breakfast, even the cold medicine you took last week without a second thought. What I'm about to reveal completely contradicts everything you've heard about the safety of these medications. Pharmaceutical companies don't want you to know this. And most doctors never mention it because they don't fully understand the devastating connection. But I've seen it, in patient after patient, in heart after heart, and today I refuse to stay silent. By the end of this video, you'll know exactly which 5 medications are secretly weakening your heart muscle, why they're especially dangerous after age 60, and more importantly, what you can do starting today to protect yourself. This is not fear-mongering. This is life-saving information. Stay with me because what you're about to discover could literally add years to your life. Number 5. The medications found in almost every home, NSAIDs. Let's talk about non-steroidal anti-inflammatory drugs, the famous NSAIDs. Ibuprofen, naproxen, diclofenac. They're the quick fix for headaches, back pain, joint pain. And yes, they work. But here's what no one tells you. Taking them regularly after age 60 is like playing Russian roulette with your heart. The medical community has known this risk for decades. In 2005, the FDA ordered these medications to carry clear warnings about the risk of heart attacks and strokes. And still millions take them like candy. Let me tell you about Michael, a 72-year-old patient who loved working in his garden. He had arthritis in his knees and took diclofenac almost every day to manage the pain. One afternoon, while tending to his roses, he became short of breath and his ankles doubled in size. He arrived in the ER with acute heart failure. His heart, already weakened by age and high blood pressure, couldn't take it anymore. The trigger wasn't a new disease. It was that harmless anti-inflammatory pill. How can something so common be so dangerous? Because NSAIDs force the body to retain salt and water, increasing the volume the heart must pump, raise blood pressure and can cancel out blood pressure medications, interfere with cardioprotective aspirin, stripping away its protective effect. Diclofenac and high-dose ibuprofen, 2,400 milligrams per day, are the most dangerous. Naproxen seems a bit safer, but the risk is never zero. What to do? You don't have to suffer in silence. Talk to your doctor. Ask directly. Doctor, with my history, what's the safest option for pain relief? Sometimes acetaminophen is enough. Or a topical anti-inflammatory. And if you must use an NSAID, remember the golden rule. Lowest dose for the shortest time possible. Number 4. The famous stomach protectors. Proton pump inhibitors, PPIs. Omeprazole, pantoprazole, lansoprazole. They're prescribed like vitamins. Millions take them every morning for years. Even decades. But here's the irony. The medication that protects your stomach might be damaging your heart. Let me tell you about Helen, a 68-year-old woman with chronic reflux. Her doctor told her to take omeprazole for life. She obeyed. Years later, her EKG showed an unstable rhythm. The cause? A dangerously low magnesium level. And guess what caused it? Omeprazole. PPIs reduce stomach acid. But that acid is essential to absorb key nutrients. Without it, magnesium absorption plummets. The result? A heart vulnerable to potentially deadly arrhythmias. On top of that, some studies link long-term PPI use to a higher risk of heart attacks. Omeprazole can interfere with medications like clopidogrel, used after a heart attack. These drugs were meant for 4 to 8 weeks, not a lifetime. If you've been taking them for months or years, don't stop abruptly. Talk to your doctor. Do I really need to keep taking this? Can we lower the dose? Are there alternatives? And insist on having your magnesium levels checked. Before we continue, a quick but important request. If this information is helping you, I ask 2 things. Subscribe to this channel. Share this video with your parents, grandparents, or friends. A single click can save a life. Thank you for your support. Let's continue. Number 3. Cold and sinus decongestants. The ones containing pseudoephedrine or phenylephrine. They're the magic pills that clear your nose. But for your heart they can be a ticking time bomb. Margaret, 75, took a very common cold medicine with pseudoephedrine. The next day, her heart was pounding like it wanted to escape her chest. Her blood pressure skyrocketed and she developed a dangerous arrhythmia. Why? Because these medications constrict blood vessels not just in the nose but throughout the entire body, dramatically raise blood pressure, act like stimulants, speeding up and destabilizing your heartbeat. They should never be used by people over 60 with hypertension or heart problems. And the worst part, they're sold over the counter. Safer alternatives: saline nasal sprays, humidifiers, local nasal corticosteroids. Don't let a moment of relief turn into a cardiac emergency. Number 2. Certain antidepressants, tricyclics, amitriptyline, imipramine. They're still used, especially for chronic pain. But they carry dangerous effects for an older heart. They can cause sudden drops in blood pressure when standing. They increase resting heart rate. They disrupt the heart's electrical system, raising the risk of fatal arrhythmias. Frank, a 78-year-old patient, took them for neuropathic pain. One day he stood up, got dizzy, fainted, and ended up with a hip fracture. There are far safer modern antidepressants. If you or a loved one take one of these, ask the doctor. Are there safer alternatives? Is my blood pressure and heart rhythm being monitored? Number 1. Calcium supplements. Yes, the ones supposedly strengthening your bones. The controversy is huge, but the concern is real. Calcium from food is not the problem. The risk comes from high-dose supplements. When you take a calcium pill, your blood gets a sudden wave of calcium your body can't use immediately. Where does the excess go? Into your arteries. This is called arterial calcification, a process that stiffens arteries and increases the risk of heart attacks. Some studies show a moderate increase in risk. Others don't. But the pattern is concerning. If you have osteoporosis, the benefits may outweigh the risks, but you should never take these supplements on your own. It must always be a medical decision. Get your calcium from food whenever possible. Today we uncovered the hidden side of 5 very common medications: anti-inflammatories, stomach protectors, decongestants, certain antidepressants, calcium supplements. My message is not stop taking your medications. My message is empower yourself. Now you know that. The pain pill can overload your heart. The stomach protector can disrupt your heart rhythm. Cold remedy can spike your blood pressure. Next time you visit your doctor, go prepared. Bring a list of everything you take, even vitamins. Is this medication still the best option for me? Are there safer alternatives? Should we monitor my blood pressure or run any additional tests? Your heart has worked hard for decades. It deserves exceptional care. And now I ask you one last thing. Share your experience in the comments. Did anything you heard surprise you? Your stories can help others. And as always, talk to your doctor. That conversation could be the most important step you take to protect your heart in the years ahead. Take care of yourself.